I hope I'm audible. I think my testing screen says the same. Okay, good. So we are good to go. So today we are going to see about examination of conscious and unconscious level of the patient. Okay, so examination of conscious and unconscious patient, like we discussed about the general history and examination like in last class. I think yes, we discussed the same. And then we are going to discuss in detail today about the examination of conscious level, assessment of conscious level, and then obviously examination of unconscious level of the patient. Okay, so this is very important. Most of the time this is like examination, like it's asked in the examination. You all, if you are watching on the mobile, you can always go on the landscape mode so that you can see in proper way. Okay, if you are watching on from the laptop, then complete screen will come to you, that's not a problem. So so good to go. Yeah. So when I talk about conscious level, okay, so what do you understand by conscious level assessment and unconscious level of assessment? I mean, this is very, very important. When I say something is unconscious, what does it mean by unconscious? Anybody? Okay, no problem. So we are going to see first conscious level assessment. So this examination we are going to see first, and this is where most of the students get confused. When I talk about conscious level, they always bring to the theory of unconscious level, Glasgow coma scale, all those things. Okay, I'm not getting into that detail. First, we will talk about conscious level, and similar to that, we'll be talking about unconscious level, where we will be learning about the different components. Okay, so I could say that most of the time, systemic problems, okay, like in the body, and problems from the cerebrum, cerebellum, I mean intracranial problems. Okay, so this usually, that causes a kind of depression to our like conscious level. It is possible. Okay, so it is not easy to have accurate assessment without any kind of scale. Okay, so in 1974, year 1974, especially, the place called Glasgow, I believe in the UK. Okay, there are two scientists, Tiesdale and Janet. Okay, they developed a system that is very popular. Glass. Okay, it's not glass, actually it's a glass. Okay, Glasgow. Okay, this is the place where it was developed. Okay, this system described, obviously every system has certain, issues, but this system is one of the most used system throughout the world today. And I could say that, like across the world people are using it, across the countries, and we are always see this as a international level thing. Any country, any report, world level, this thing are being used. Okay, so like actually lot of terms, earlier using like a stupor or semi coma or medium coma or deep coma, what you say. Okay, so these all things were not used in this level. So what actually the conscious level were described in terms of, there were three basic terms. Okay, so like this I will write it here one by one so that, like it will go easy for you to keep in the mind. So description of basically the conscious level was done in three terms. Okay, what all it was? First was, I won't be able to see most of your message. So when I say that later, when I ask or something, or you ask something, I can see because this is complete different screen. Okay, so it was in three. It was in three. Yeah, it was in terms of either. Let me make it. Okay, it was eye opening, very important. Okay, obviously all three are very important. I'm not saying that, but first is eye opening, second is verbal response, and third is motor response. Okay, these three components they brought in picture first. Okay, obviously later they divided into certain other components that we will see later. Okay, so these three components you have to keep in the mind. What is that? Eye opening, verbal response, motor response. Will you be able to remember? All of you? Nice. So, after learning these three components in bit detail, then we will be going for the unconscious level examination. Don't worry, today's class won't extend enough. Okay. So, after that, we'll have 2 minutes of break. Then again, we'll start our another examination today. Okay. So, coming to the next board, eye opening. What all components are here? Eye opening. You have to remember spontaneous. Remember the word, it's very important. Those who don't understand, ask me later. First is spontaneous, second is eye opening to speech. I'll detail it, don't worry. Eye opening to pain. How do we create it? I'll go one by one detail. Now, suppose a patient is getting admitted in ICU, okay, and you need to find out what is the coma scale, what is not coma scale, what is the conscious level we are talking about, what is the conscious level. You'll be starting with the three components: eye opening, this is Baba, I'm talking about eye opening, verbal response, and motor response. In eye opening, how do you decide what is the stage? First is spontaneous. Suppose name is Alex. So the moment it comes, you say, Mr. Alex, you ask, bit loudly, Mr. Alex, Mr. Alex, or whatever is the name, or anything. Okay. So what happened? Like if spontaneously eye is being opened, then we will consider it's a spontaneous part of the eye opening. Okay. Okay. Well, to speech basically. Okay, to speech you're talking higher and then speech. Okay, so the moment immediately it opens the eyes, spontaneous to speech. Okay, if you take the name or something, then only the opening the eye. Then what happened? Like the pain. So what happened actually to pain? Suppose this is like a face. Okay, and this is eye, this is eye. Where you have to press, you have to press. This is like this eyebrow is there. Okay, you have to press this place. What is this press actually will be? You have to press supra, anybody, supra orbital nerve. This is irritating. Okay, so that's where the patient will open the eye, if he or she is in that level. Or you can also like press the nail bed of the patient. That's also one of the technique in the eye opening to pen. Okay, if eye opening is to pen, then these two places you could use. Anybody, any problem is there? And then last part is none. Even though you give speed, you keep shouting, or you do eliciting the pain through your through your pressure on the supraorbital nerve of the patient, or even on the nail bed, nothing is going to change. Okay. Now next we have to see next component. Next component is verbal response. How the verbal response goes? Verbal response can go in five ways. Okay. First we will talk about oriented. Okay. Oriented. So patient usually know what is the time, what is the place, where is the hospital, everything. Okay. Knowing time, place, date. Okay. Almost complete oriented. Second is confused. You would have seen patient being confused. Okay. So confused, usually we say, they'll be talking some sense, no doubt they'll be talking in terms of sentences. They will tell you that I had this breakfast, I like this kind of food, or this kind of book, or like I the capital of India is Delhi. All those things they'll be talking in sentence, but usually the time part is confused. Time part is not very actual. Okay. So time part or even the place, they'll be disoriented. You understood the difference between oriented and confused? Don't get any kind of confusion later, because we are going to use this term widely in our subject later. So what we are doing today, or what we are doing past 10 classes, we are doing the foundation class. Okay. All these building blocks are going to work for you, for us later. Okay. Next is words. Okay. Yeah, like this kind of patient, no sentence, but and I have seen many cases like this, no sentences, but sometimes occasionally they'll be talking word. Okay, I have seen even the patient with the global aphasia occasionally talking some words. Occasionally, aunga, jaunga, no, yes, not very clear. I mean, not very, may not be very clear, or depends upon the condition, but occasionally words, obviously no sentence, not even three-word sentence. Then come fourth part is sounds. Sounds. Any kind of grunting sound you would have seen, grunting sound or groaning, all these kind of sound, but no clear word. Okay. Fifth is none. Again, nothing. Okay. So one can see, coming from this side, if you see from the oriented part is everything is clear: word, sentence, time, place, date, everything. Okay. Confused, it is in sentence, but time, part, place, all are, like a time part and the place part is usually disoriented. Words words no sentence, but occasionally some word, it could be sensible. Okay. Sounds means only sound, grunting, groan, or a kind of humming sound, but no clear word. No clear word at all. So what we will see here, what we will tell here, no clear word. So in this category we will say as sound. Then none, nothing is there. Okay. Now next part is, we will go with, what is our next part. Like last part we were talking about motor response. Motor response is it's a key, and here only you will get stuck in your practicals. I'm telling you, examiners will ask you something and you will get stuck. So then I'm telling you, whatever I teach, learn it very clearly. Very soon your recordings will be available. You can go through the video again and again, make a note and learn it. Ask me the questions in next class. I'm telling you, here only you will, your examiners will get you stuck. Okay, first part is obeys command. Okay, a patient moved to your hospital in ICU, and then like after certain some head injury has come, in road traffic accident, but you are asking something and he's able to obey the command. Means suppose you say that touch your nose. Okay, he's able to obey the command. Could be his eyes are closed, but he's able to obey the command. Okay, now second part is what? Second component could be localizing to pain. Okay, means you have told something he hasn't heard, but what happened when you apply some pressure to supraorbital nerve? Okay, you may have to increase obviously some of the more pressure on supraorbital pressure you have to increase. So is there any pain? He'll try to touch that. Okay, so localizing to pain, we say. You understood my point? So suppose patient is lying down. Okay, and what did you do? In like obeys command means you ask something and he's able to answer you. Okay, you are telling him, okay fine, touch your nose, he is able to touch. That means what? He's obeying the command. But second part, what I said you, he's not obeying the command. Then what are you going to do? You are going to apply some pressure on the supraorbital nerve again. Okay, and increase your pressure until he is touching that part. If he's not touching, that means he's not in this category. Simple, very simple. Okay, now third part is just understand flexion to pain. Okay, flexion to pain. Here in this case, what happened? If the patient is not getting, elicited even with this, then what are you going to do? You are going to increase the pressure. You are going to, sorry, apply the pressure with a blunt object or pen or any hard object like key or something on the nail bed. Okay, आप क्या करेंगे? nail bed पे pressure डालेंगे एक hard blunt subject, एक hard blunt object से. Okay, so what will happen? Elbow flexion. If it is happening, then you have to tell that it is a flexion to pain. This is the response. Okay, okay, now come to our next extension to pen, or I'll write it extending to pen. When can it happen? Any idea? Have you seen the patient? Okay, same stimulus you are doing. Okay, you are putting pressure on the nail bed only. But if rather flexion extension happen, then what you will record as it is a extending to pen. Got my point? Here what was happening? Flexion was happening. Flexion. Here what will happen? Extension. But maneuver is same. Okay, the process is same. Here extension will happen. Okay, and the fifth part again coming to the none. Okay, now dear student, just see one thing. In all of our thing, we started from the number one. So you should remember the sequence. Okay, we are now going reverse from motor response to make you understand. Suppose motor response, three categories. Okay, eye opening, verbal response, motor response. Okay, suppose I'm going here only. No problem. Eye opening, spontaneously happening. If not happening, where are you going? To speech. If this is not happening, then where are you going? To pen. If nothing is happening, then what we are going? Then nothing is happening, then you will record as none. Okay, coming to the second part, oriented. What did you do? If he's oriented, okay, you will record. If it is not oriented, you will go for second part to see whether he's confused. If it is not happening, then you'll see whether he's able to do make some words or not. Maybe sense or may not be sense. Then no sentence, no words, nothing, then he's making some sound. Okay, you will record that. Nothing is happening, then you will record as none. Understood my point? So this sequence has to be maintained. Obeying command, If he's obeying command like you hold up your arms, touch your nose, something he is able to do, you will record obeys command. Okay. If he is not able to do but he's able to localize the pain, you'll be recording it. Then if he's not able to localize pen, okay, fine, localizing to pen. Again, I got in message like I saw accidentally one message. Yeah, the comment it is like sir, please repeat. Okay, fine. Supraorbital nerve pressure you have to give, Baba. Supraorbital nerve you have to give pressure, and so that like the pen will elicit, and that's where the patient will touch. Okay. Okay, if that is not happening, you'll go for this. In this case, you should use a hard object like key or a pen. Okay. And you should go for the nail bed pressure. Okay. See, all these practical parts I teach very carefully. Reason is like this is where it's going to work for you in the practice as well as in examination. Okay, key pen, anything. Then what happened? If he's able to do the elbow flexion, then we will record as flexion. If he's doing the extension, and when it can be extension, anybody can tell me. It is possible it can be extension, but when? Okay, think it and tell me in the comment. No problem. I'll see later. I'll come to the wearing part. Okay, then it will go to the extending to pen. If nothing is happening, then you will record as none. So these three components you will remember. Okay, but you can make it as note kind of thing. Motor response will definitely vary whenever you do the examination. Okay, extension response, supraorbital pen can cause, definitely can cause, but fingernail pressure, it also produces flexion, no doubt. Okay. Yes, yes, true, it is possible. Okay, you have to see the final, like finally what he or she is able to do. Okay, for the, like, yeah, for the very same purpose of assessment, what you can do, you can only use the, this is also the key, always remember, I'm just keeping it in a box kind of thing so that you can remember. Okay, always use the arm. Okay, don't use the leg. Anybody can tell me what is the reason? First of all, because leg response will always be less consistent result. Okay, to pain. Why? Because it is more of peripheral origin, so it will work more of peripheral nervous system. Okay, sorry, it will be central nervous system only, but it will come into more of spinal nerve origin. Okay, but here it will be more of cerebral nerve. Arm will tell you more consistent result. Okay, so never get confused in front of examiner. Also use always arm as your choice of assessment. Okay, so this was for the conscious level assessment. Based on the same thing, we are going to see the unconscious level also. Okay, should we? Yes, thank you. I'll just check, is there any question to me, then I'll come back. Okay, Sofika, you wrote EMV. What does that mean? Can you be a little more clear about it? You can unmute and you can talk if you want. I have no issues. Or you can talk to me even later. There's no problem. Okay. So now we will see what we saw the conscious level like. Okay. Now we will record it. Okay. Now we will record it more specific shortcuts. Okay. Okay. Nice. Now we will record it more of the unconscious patients. Okay. So how are we going to do the examination? What has happened to me? I don't know. Examination of unconscious patient. See, I always teach in that way. First, I always go with conscious. Once you understand that, then only I'll go with the unconscious. Now, after learning these things, you will see that, sir, it was almost same. Yes, it is. But you should learn how. like what is the assessment factors and how we can categorize in terms of numbers. Okay, so well, now how it will differ from normal like studies, just see that. Okay, well, when it comes to the unconscious patient, now you can remember from your older class what we studied. What are we going to take first? Any examination, like what are we going to take first? History. Okay, now if patient is coming after a road traffic accident, head injury, or maybe like a bullion barre syndrome, totally unconscious kind of thing. Okay, sometimes because of other reasons or multiple something he is coming with. Okay, it is not possible to talk to the patient, that's for sure. You cannot be thinking all the time talking to the patient, right? He's not in condition or she is not in condition to talk. Okay, so what do you have to do? You have to question, getting all the information, questioning the relatives, okay, friends, or anybody who brings him. Okay, like suppose ambulance, which condition he was found, how much blood was lost, all these things you need to find out. like you have to be very very specific to find out how it happened. Okay, okay, which condition he was lying, if possible, like what was mechanism of injury, like how, where, which kind of hit vehicle had hit. So this is where it constitute the very essential part of assessment. So if in your examination you get this kind of question, suppose 5 marks question to write in your practical examination, always write this part. You will remember history, inside that you are going to write this part. Okay, never ever forget this point. I hope everybody understood that, the importance of this point. Okay, I have star marked it, it's very important. Okay, now after that you have to find whether it is a head injury, because the coma kind of situation is seen, right? Unconscious level situation is seen. Okay, so head injury or any kind of injury which is leading for the admission in the hospital immediately or little late. Okay, then you have to find out whether it was a collapse, you know like a switching off mechanism in parkinsonism, that day we were talking about collapse suddenly. You have to just ask that. Okay, then other things what you are going to ask, any kind of previous illness record is there. Okay, any kind of previous illness record is there, relevant past history. Okay, then you have to ask any kind of medication, drugs. Okay, any kind of medical drugs, like medications patient is on. So history part is very very important, these 4 5 points. Okay, now we'll go for the next part. Next part is very simple. It is I hope you all remember what we spoke last time is general examination. I got a message in last class that sir, I slept during general examination when we were taking class. I understand few of the students belong to far, and they have a like usually the classes and like OPD hours late. I understand, but you can always revision. You can always do some revision when you read the when you go through the recordings, no problem. So general examination, last time we discussed more than 20 points, right? Like temperature, fever, any sort of skin changes, any sort of systemic illness, diabetes, or any kind of present condition, like any more of, I will write like a more of like a diagnostic science. So basically Diagnostic signs. If somebody has a heart problem, if somebody has a, you remember, cardiovascular issues. So importantly, what is relevant, we have to, relevant info we have to take into consideration. Okay. Or suppose somebody is with a seizure, so you have to see what that day we were discussing, right? Tongue biting. Okay, any kind of seizure, tongue biting. Or suppose there is a head injury, so you have to see like a kind of any kind of glass injury, or any kind of signs of head injury. Head injury is a very big chapter, we will discuss in later. So a sign of injury to head. Okay. Or is there any kind of glass cut injury, or like a blood loss, or any sort of clinical state, we need to find general clinical state. Okay, including alcoholic habits. you know you will find many neuro cases with alcoholic habits, like having history. So don't undermine this. Okay, general examination is very important. So this is how you have to write in your examination of unconscious patient will, how will you write? I'll go to the previous board if I have a time. If I have a place, I'll just note it down, don't worry. How you have to write in the points. In the points you have to write. Any question comes, first of all, take the, just a minute, some problem with the stylus. Just a minute. So how you have to write? You have to give, first point will be history. Okay. Second point will be general examination. Don't forget these point to write. Okay. Third point will be neurological examination. Right. Why? Because neurological examination is the something what we are going to study properly. Okay. And at last we have to write the important notes. Okay, what are we going to do in the notes, that we will see later. First, these 3 points you have to remember. So point number one, point number two, point number three. So we are currently finishing the point number two, like general examination. Okay, general examination as per like what we discussed that day. Now neurological examination, this is the most important. What we studied in neurological examination, all of you student, please tell. Yes, yes, that's what I'm saying you. Conscious level assessment, we have to make it. Okay, so it serves as a prognostic guide. Okay, it actually provides you a fundamental where you can do your all future examination you could based on. Okay, I mean to say, today what is the coma scale, tomorrow what is the coma scale, how the patient is coming out of coma, or no, it's not coming into the coma, coming from the coma, everything. Okay, so our these things are based basically on the four level of exam, three components of examination. Okay, and we have a 14-point scale. 14 point scale. Based on that, we always say what is the response. Okay, so first component what we studied is eye opening, right? This is what we studied now. If you remember, one of the first component, eye opening, right? Okay, here what they have done, here they have given the number to the subcomponents. Okay, we studied spontaneous. Okay, then we studied what? Eye opening to speech. No, Rohit, it is speech, not to pen first. Remember the sequence: to, pen, and obviously after that it was none. You know what? They have given certain numbers to that. Okay, certain numbers. So we will also use our number here. Spontaneous has been given 4, to speech has been given 3, to pen has been given 2, and none has been given 1. Okay, okay. Second component is what, student? Anybody? नींद तो नहीं आ रही? Verbal response. ठीक है ना? Verbal response. Here how many? We had a division. Here we had division. Remember? Oriented. Okay, where patient is able to tell the time, place, situation. Okay, how he came to hospital, everything. Okay, oriented. Then what we had? Confused. He is able to tell what he had as breakfast and what he likes more, coffee, tea, or he likes food, or his like choice of books, his choice of TV series. Everything is able to tell, but he is not able to tell what is the date today. Okay, it's very very important. So what we are categorizing as confused. Okay, just 1 minute. Confused. Then what we have, other category, anybody? After confused, what was that? Where he was able to do the word, pronouncing some word in answers in words, may be sensible, may not be sensible. Okay, then no words, no sentence, nothing. He is just making some sound, groaning. Yes, 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 definitely. See, there is a very good question. Question is, the sound is because of what? And is it because of pen only? No, not at all. It is not because of pen only. It is because of neurological condition also. Okay. Yes, 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 yes. No, some stylus problem has come. I'll change next time. Okay. Yeah. So oriented here, what is the point has been given? Anybody has any idea? Have you read it? Have you seen the chart in hospital? Oriented has been given 5. Confused 4. Words 3. Sounds 2. None means 1. Descending order. Okay. So this is the component of, like, these were the components of eye opening. These are the components of, subcomponents of what? Verbal response. Then we have a third category which we studied some time back, is what? Very important, tell me. Motor response. Because your problem in examination, I'm talking about the practicals, the examiner will ask you more question from the motor response part. Okay, because this is where you will get confused, and here only you will make a mistake. Okay, now here few books have divided into 6, few books have divided into 5. We will consider it as a 5. Okay, where the difference comes, I'll tell you. So starting with, you remember, obeying commands. Okay, second one is localizing to. Remember we were doing our discussion about localizing the pen. So localizing the pain, I mean to say, like seeing, like feeling that pain, there is a movement of arm. Okay. Now what happened? There are two. Okay. Normal flexion and spastic flexion. Okay. We will take it as a flexion. Okay. Normal flexion. No, there is a question that which kind of flexion. No, I'm talking about normal flexion. Okay. Yeah, because normal flexion and spastic flexion, that they had done just for their study purpose. Okay, you remember this much extension. It will be easy for you, extension. And then at last was none. Okay, so these are the components of, these are the components of motor response. You remember? Yes. So now you have to give number. Okay, so obeying commands, how much will it go? 5 localizing, 4, then flexion will be 3, extension will be 2, and none will be 1. So you could see 5, 5, and 4. Okay, okay, hold your question for a minute, I'll discuss this. Okay, see the highest score, students, it's a oriented, means the either from the eye opening spontaneous and motor verbal response 5, and then motor response is obeying commands 5. Means 5 plus 5 plus 4, that is 14. 14 is the good state. Okay, and come to the last phase, 1 1 1. So 3 is the list phase. So what you will level as, 3 as a list, and 14 is a alert. List means comma, but comma has different again section, subsection again. So list. Okay, either it could be 3, means complete deep state of coma, or 14 if you are saying, that means it is a alert phase, complete alert phase. Okay, okay, how you have to see, component number, component number 1, then you have to see component number 2, then you have to see component number 3. So rather than 1 2 3, I will make it as a easy for you to remember. It is a, just a minute. So this is the first part A, then the second part B, and the third part is C. Okay, in that you see, now what happened, whatever you find, you have an objective value and you add up and you bring the proper comma scale. What is the value? Okay, now yeah, I'll come one by one small part of this so that you don't get confused. Okay, let us see the next board. Okay, you know, pupil response. Have you seen any one of you in your like hospital duty if you have been posted pupil response? Okay, so here what happened, if patient is not cooperating, still you are able to see, because these are called the signs. What a medical person can see is sign, what patient says is the symptom. That is how you decide, like this is how you define the signs and symptoms. I hope you understand this. So here you have to see pupil response. I mean to see what, like fundy, then corneal reflex. I'm sure corneal reflex you would have seen earlier. That is tone. Okay, that is tone, ciliary muscles. Then limb. Okay, reflexes. Just a minute. Limb we will discuss later. No problem. So pupil response, basically you know that fundy and then corneal reflex where we see the tone. Okay, so here even though patient is non-cooperative, you'll be able to see what is the response. Very clear. Okay, come to the other part is called eye movement. Okay, since we are able to notice the what is the conscious level of the patient, I mean what is the unconscious level of the patient, in this case what you are going to do, you have to observe what, first thing what I have told you is a spontaneous eye movements. Any kind of spontaneity in eye movements. Okay, and is there any kind of oculocephalic reflex, we say that. Okay, you have to elicit that. Okay, oculocephalic reflex, very popularly called doll's reflex, sometimes asked by examiner in viva. Okay, then what happened, patient is lying down, what are you going to do with the eyes? Being an examiner, what will happen, eyes open, eyes, I'll write it, eyes kept open by examiner. Okay, what are you going to see after keeping the eyes open? Anybody have seen that in hospital? No. Okay, no problem. You have to check any kind of movement. Okay, is there any kind of movement? Then whether it is a conjugate or it is a disconjugate. What is conjugate and what is disconjugate, I'll tell you. Okay, two eyes are there. Okay, if they are moving, both are moving in a parallel direction, then it is a conjugate. If they are not moving in the parallel direction, then it is a disconjugate. Okay, these kind of movements. Okay, now tell me these ocular movements, which part of the brain could be the problem? Tell me, इतना पढ़ाया कुछ तो बताओ. ये ocular movements गड़बड़ा गया तो which part of the brain we can think there is a problem? Tell me, anybody? Just a simple logic. This type of assessment we are going to do, then there should be some benefit, right? You remember mid brain, we were talking about mid brain, so I told you, if I remember, like completely for eye. If you don't remember anything, just remember like this. What else I can tell? and pontine function also that say that there is some problem if there is some assessment. During assessment we find some deficit. Okay, sure. Now this is the part which was related to the eye movement. Okay, now do you know how to check visual field? I'm sure you all know. Don't tell me you don't know. पता है ना visual fields. Okay, visual fields. Anyway, we will see in our cranial nerve this one also. But what you have to see, suppose a patient is uncooperative, not able to speak, not able to say anything else, or not able to give any sort of idea, then what will happen? Then examiner has to detect there is something called hemianopic field. Okay, hemianopic field. What is this about hemianopic field? No, no, no. What happened here in this case? You can say, like, one side, if they are menacing, it fails to produce any kind of blink. Yes. So any kind of blink, it fails to produce any kind of blink if they are menacing from one side. That happened. Okay. So this is one thing. This all examiners can detect. Okay. Then there is something called oculovestibular reflex. Again, we will study these all things when we come to the particular disease. Okay, oculovestibular reflex. I'm just telling you how beautiful this system is, that you can find out a lot of things even when the patient is not cooperating you. Then what we can find out? Obviously we can find out about the facial weakness. Yes. Well, suppose one eye is closed, one side weakness comes in stroke, right? And when suppose unilateral stroke is like unilaterally one part of the face is gone, in that case there will be failure to grimace on one side. No, I'm not telling that. I'm telling that suppose this is the patient. Okay, one side eyes is closed. Okay, and you can actually see that face is also drooped one side. So you can actually find out that there is a weakness in one side, right? So grimace on one side, suppose this is the left side. I mean, not suppose, it is left actually. So there is a, like a grimace getting fail. So failure to grimace on one side, when it happens, especially when there is a supraorbital pain. Just 1 minute, my stylus is not that active right now, so it's taking time. So both side, there is a pressure on supraorbital pain examiner has elicited, and there is a failure to grimace on one side, even despite giving the supraorbital pressure and eliciting pain. That source was facial weakness of one side. Okay, so these all are tests. We are going to understand this even better later. What I'm saying you, this is the beauty of this system. Okay, let us see one more board. In this we are we saw a lot of thing about the motor response. So limb weakness also we will talk in very brief today. In our next class we will see that limb weakness in much detail. Limb weakness. Okay. So here you have to compare the response to different stimuli. I mean to say, uh, like a right and left. Okay, suppose there is a patient here. Okay, there is a patient here. Okay, and what happened here? You are creating response. I mean to say that painful stimuli. Okay, but you are creating to each side, both sides, बोथ साइड्स कहने का मतलब क्या है मेरा, लेफ्ट में भी है, राइट में भी है. ओके, सपोज दिस रिजल्ट्स यू इनटू द, result is into the asymmetric response. If it is an asymmetric response, what you will list as, what you will list as, it is a unilateral weakness. Very simple. Okay, I will tell you one more thing. Yeah, somebody was asking in between, like extending to pen, like how it is extending to pen. Usually when there is a, I told you, I think you did not notice that time. Like suppose you are giving nail bed pressure. Okay, pressure on the nail bed through any hard object, key, any blunt object you are giving, and patient is having extending rather than flexing. That is the extending to pen. There is a response. Okay. Okay, a small 2 minutes of your time. Two patients. Okay, upper limb. Let us say this is upper limb. This is upper limb. Okay, I will come to that later. Okay, now what happened here? See, you gave supraorbital pain on that. Really? Supraorbital nerve you pressurized. Okay, then you created pain. Alexa, stop. Okay, so what is happening here? In first case, he is flexing. Sorry, just 1 minute. What is he doing? He is able to localize his pen. Okay, he is able to localize his pen through the left. Okay, here what is happening? Localizing left, right? And what is happening? This hand also, it is getting flex. Okay, this is a possibility, and flexing right. Well, now here is what happening. For this case, okay, for this patient who is also in the coma, I'm talking about the situation in second situation, number two. Okay, in his case, when the right part was given the supraorbital pain. Okay, so what is happening here? He is flexing left, and what is he doing? Extending right. Maybe this concept you will understand little later, but this is very good concept. Extending right and flexing left. Okay, so what is that? Both are in coma. Both are in stage of coma. Okay, but both are having a asymmetric response, right? Asymmetric response. Are you sure? Right. Asymmetric response to what? To pain, what we created as supraorbital region, supraorbital nerve pressure, right? Right. This is where it happened. Okay. So what it is indicating? Anybody can tell me? Anybody can tell me? Because what is happening here? Flexing the right, and flexing the left. Okay. Both are different. But can you see one thing? That when the left part of case 1 was pressurized, the right part of the limb was flexed. Okay, and when there was right part of the case 2 was pressurized, okay, right supraorbital nerve was pressurized to elicit pain, the right part got extended. I mean, the right part got into extension. So what exactly the problem is? Right arm weakness, right? So we will say the problem is right arm weakness. I know right now you must be thinking what sir is telling and how it is, but it is a right arm weakness. Okay, it could be because of focal brain damage. Okay, okay. So this is one of the simple example. Okay, as you will be learning more and more about it, you will be knowing more and more into detail about it. Okay, more and more when you take cases, more and more you learn about the new cases, you will understand how the response comes and how you have to record the response and how you have to come on a judgment like what is the condition it could be based on the scale. Hmm? Fine. Now, no, there is a question that, sir, could there be a difference into the both part? Definitely, if there is a unilateral damage, then there will be definitely difference. Okay. Other question is like, can we do it on the lower limb? Okay, fine. You can always you can always apply stimulus on the toenails or even the, which is the greatest tendon of the body. I mean, which is the largest tendon, the strongest one? Anybody? Achilles tendon, right? So Achilles tendon also you can pressurize with some hard blunt object, okay, and test. You can test the power in the like lower limb. It's not that you cannot. You can, okay. So definitely there will be a variation in the tone. There will be variation in responses. There will be variation in the respective reflexes and plantar responses of each side. Okay, that indicates the focal deficit. Okay, that indicate purely the focal deficit. Yes, yes, true. It is a focal deficit. Definitely. It is a, obviously that objective it won't, but yes, it will. But normal practical also. Suppose I'm an examiner and I'm not able to detect the difference in response to what you say the painful stimulus, which I created with a blunt object. Okay, but these features, like normally it is difficult to get convincing evidence, no doubt about it. But yeah, I mean at least it gives you what is the level patient is in. Okay. So where we started, once again we can just have a look. So we started with a consensus level assessment examination, okay, 1974 in Glasgow. It was discovered. It was actually brought into the practice, and this is world's one of the best system, I can tell you, across the globe. It works. Okay, it doesn't use any kind of vague terms like semi-comma or deep comma or anything like that. Okay, the two person, Chesdale and Janet, who brought this system, we must be thankful to them. And this kind of description, it has three levels: eye opening, verbal response, and motor response. Eyes opening, as I told you, spontaneous, we have to check. If not, then you have to go to the speech, to the pain, and then none. Make sure, students, you are going into the order. Then verbal response oriented, in that case knowing the time, place, date, hospitals, everything. If not able to know, then you have to see whether the sentence he'll be able to correct, or he'll be able to make it, or she'll be able to make it. But time part, especially time and place, will be disoriented. Okay, then words. Yeah, third is words. So in that case, no sentences, occasionally some words will be pronounced. Okay, and in fourth case, if you are not able to see even the words, you have to find out any kind of sound is there. If no sound, patient is lying totally calm, then you have to record as none. Okay, after that, third component was motor response. Sub component comes obeys command. Patient is able to obey the command. Always go with the arm, don't go with the leg. Okay, because it is more of cerebral, CNS origin. Like arm will be easy for you to elicit. Localizing to pain, you have to see whether patient is able to localize the pain. Localizing the pain, you have to do with the supraorbital nerve pressure on the supraorbital nerve. Okay, then you have to check whether there is a flexion to pen after pressurizing the nail bed. Okay, is there any elbow flexion? You have to check it. If not, then is there any kind of extension? If nothing is there, then none. Okay, all these things we'll be seeing in our practical classes as well. Okay, then examination of unconscious patient, you have to have into three forms, like history, general examination, and neurological examination. Okay, this is very important question. History, you have to always uh, have a question from the relative, friend, or anybody who has brought to the hospital. Okay, ambulance, these are very essential part. Head injury is there, or any kind of admission is required, or collapse suddenly, or what happened, like any kind of previous past history, past medical history record is there, or any kind of medication patient is in. General examination, you know, a lot of things, like right from temperature, pressure, all kind of vitals, cardiovascular issues, respiratory issues, skin issues, or any kind of systemic issues, diabetes, hypertension, everything, including alcoholic habits, you have to find out in general examination. Okay, but our part is more of neurological examination. So here we are using the 14-point scale in that three component, as we discussed earlier: eye opening, verbal response, and motor response. Eye response will have further sub components like spontaneous, to speech, to pen, and none. This has been given a number like 1, 2, 3, 4. You can see right from the none, 1 to pen, 2 to speech, 3 to spontaneous is 4. So I would say you that you remember these numbers from the descending order, so that it will be easy for you. Okay, now verbal response, again oriented, confused, words, sounds, none. So 5, 4, 3, 2, 1 respectively. And then motor response, again obeying commands, localizing to pen, and then flexion, extension, and then none. 5, 4, 3, 2, 1. Well, now if you consider the none part in all three components, 1 plus 1 plus 1, that is 3. That is a list, like list alert. Not alert at all, list, complete deep coma of deep coma state. And then if it is a 14 point, in this 14 point completely it is making, that means patient is not in coma, he's in completely alert stage. Okay, and then we discussed about some of the like responses also, like how do we have to see the pupil response, and then all these things. Anyway, in respective chapters we are going to see eye movements, you have to observe, you have to see the oculocephalic reflex, jaws reflex usually. Sometimes examiners ask you. Then you have to go for the some of the limb weakness also, like how you have to elicit. So in our next class we are going to learn more about the higher cerebral function, and then we are going to learn about the limb assessment, limb, basically upper limb and lower limb examination. Okay, and we are going to learn more about what we say, the cranial nerves, the nerves examination. Yeah, cranial nerve, and then higher center examination, and then examination of upper limbs and lower limbs. With that, we will finish our examination part, like class number 3, as we have decided. 3 classes it will be done. So today, I think it's been more than 11. So just 1 minute.